The Doc is In is sponsored by Amada Senior Care.
Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us in studio.
Great to have him here this morning. He's focusing on those dreaded sinus infections and how antibiotics may be hurting, not helping the problem.
Yeah, everybody's got some level of the creepy crud or have had it over the last few weeks, and so we're getting a lot of this in the emergency department. I've had a couple people get pretty upset when I say I'm not going to give antibiotics.
Oh, yeah.
Okay.
And so we're going to set the record straight here. So this week I did have a patient or two that got quite upset when I wouldn't prescribe antibiotics for the upper respiratory infection and presumed sinus infection. Antibiotics are not indicated for most episodes of acute sinusitis because most cases, 90+%, are caused by viruses, not bacteria. Viral sinus infections typically resolve on their own within 10 to 14 days, and antibiotics have no effect on viruses. Overprescribing of antibiotics in these cases contributes to antibiotic resistance, making bacterial infections harder to treat in the future. Even in bacterial sinusitis, studies show that antibiotics offer minimal benefit, as most cases will still resolve without them. The body's immune system can often clear the infection on its own. Additionally, antibiotics can cause side effects like diarrhea, allergic reactions, and gut microbiome distribution issues. Clinical guidelines consider antibiotics only when symptoms persist beyond 10 days, worsen after initial improvement, or are severe, such as a high fever, especially in those with risk factors. Instead, treatment should focus on symptoms management such as nasal irrigation, decongestant, pain relievers, the good old-fashioned stuff. What we do know is that if the sinuses drain, the infections will go away, and the vast majority of times antibiotics are not always indicated. And interestingly, what happens is people take the antibiotics, and after 5 to 7 days, they think the antibiotic made the difference when it's actually your very own immune system that saved the day.
So let me ask you this. When you explain this to your patients who come in and get a little heated about you not giving them anything, how's it go over?
It doesn't typically go well because the answer I often get is when I go to this place, often walk-in clinics, I always get this. And so just remember that many of these clinics out there are satisfaction based, making you want to come back more. Now, they're not necessarily clinically and evidence-based. With us in emergency medicine with sinusitis, we're actually penalized financially by the federal government when it comes to giving antibiotics for acute sinusitis. So there's a different level of scrutiny that's involved there. So remember to go to somebody who's going to give you what you need based on what you have, not what you want because you think you need it.
I didn't go to med school, so I trust you, Doc.
Yeah.
Thank you.
I get their frustration, but it makes sense now.
Yeah.
That's what you're saying.
We don't want to make things worse in the future.
Yeah, no doubt. All right, he's going to be back a little later this hour talking about the measles, right?
Absolutely.
Stay with us.
You're watching Fox 56 News. Our home, your news.